Justin, well, Right at Home's professional teams have decades of experience providing care in their communities. Here to tell us about their services, along with a new benefit, is owner Stephanie Humphreys. Thank you very much for joining us.
Absolutely.
So it's very busy today.
Yes, I noticed that. The studio is really hopping.
It
so
is.
that's awesome. That's awesome. Well, I appreciate being here. So
yes.
yeah.
So remind everyone what a Right at Home is.
Yeah, absolutely.
Yeah.
So we're really a full-scale home health company. We have a team of home health aides that can come in and help people any way that they can in someone's home. So it could be cooking, reminding people to take their medications on time, and also personal care. So if someone needs help in the restroom, getting dressed, you know, bathing, things like that. But also a higher level of skilled care. So we've got a team of nurses, we have therapists. So really, we really try to meet every need that someone has wherever they call home.
Right. So it's a great way for people to say age in place. Is
Absolutely,
that appropriate?
Yes. Yeah, absolutely. And that's a discussion that we really have with our families. When someone calls and they're interested in maybe pursuing some services, we come out, we do a full home assessment, and that includes like a home safety assessment, providing recommendations on maybe they need to just move some furniture around.
That simple.
Exactly, exactly.
Yeah,
making sure their pathways are clear and things like that. And so we really provide a lot of education, help people understand everything that we can do for them, and really get a good understanding of what their aging goals are.
Right.
So
there's a new benefit that just launched. What is it, and how does it work?
Yes, so it's encouraging because Medicare has actually recognized the need that caregivers have, you know, primary caregivers, family caregivers, that need a break, you know, need some respite from taking care of their loved one that has dementia. So these are for families that have been affected by dementia, and also importantly, it is for recipients of traditional Medicare. So I just want to make that very clear that people that are on Medicare Advantage plans are not going to qualify for this benefit. So it being, I think, open enrollment starts, I think, next week, and usually goes through early December. This would be an ideal time to think about maybe switching to traditional Medicare if you want to take advantage of this benefit.
That's good to know that traditional Medicare, not the Advantage plan.
Exactly.
All right.
So the respite care that we can provide, it is up to 72 hours a year, where someone from my company can come in and take care of the person with dementia, and their primary caregiver can really just get a break. Maybe they're getting behind on their own medical appointments. Maybe they just want to meet a friend for lunch or get their hair done, whatever. So it's just nice that Medicare is recognizing that there is that need. There's caregiver burnout. You know, I think people need a break from whatever they're doing.
True,
but,
absolutely.
Caregiving is hard.
It is, and I was unfamiliar with what respite care was. So now I know.
It's having a paid professional come in and give a family caregiver, just giving them a break, and we're providing all of the cares that dementia individual needs. So.
What questions do you want individuals to ask, or their loved ones who are caring for them, to ask when choosing what's right for them?
Well, it's important for us to really know, we want to provide patient-centered care, and so it's more the information that the family and the potential client is going to provide for us, because we really believe in assigning a home health aide that is the most ideal for that patient or for that client. And so we want to know everything about that person, just what their nuances are, what their preferences are, and so we can best assign the right respite worker for them. So it's more of gathering the right information, I think, on our end to ensure the perfect match.
So it's very important to have the caregiver with the individual. You know, chances are, if the person is suffering from dementia, they would be anyway. But in any case, kind of work together to get the right.
Exactly.
Okay.
Have a
plan.
Yes, have
Yes.
a plan in place. We unfortunately encounter a lot of families that don't plan ahead so much. We encourage people to come up with a plan, even in an emergency situation.
Sure.
But just realizing, what are my aging goals? You know, do I want to be at home? And realizing that we can help people even if they are in a nursing home or assisted living. We meet people where they're at.
Okay. All right. How can people get more information and contact you?
Yes.
Yeah.
They can always give us a call. We answer our phone 24 hours a day.
Okay.
You know, 319-826-6608. And then also our website, just Right at Home Cedar Rapids. You can look us up. Just do a Google search, Right at Home Cedar Rapids, and there's a lot of information there too.
Okay. Wonderful. Thank you so much for joining us.
Yes, absolutely.
Appreciate it, Stephanie.
Thank you. Thank you.
We'll come